there are measurable means of verifying that people have depression. It's a little bit different from sadness, right? Like people can be sad, they can be happy. Depression is a clinical diagnosis. We have depression over things that are important to us.
Yeah.
So you can't judge a person's life experience and how it makes them feel.
Hi, welcome. Thank you for joining us today for this podcast. Today we have Dr. Dimitri Gitelmaker. He's a doctor here in the United States, and he's going to be with us today talking about depression, mental health. Just a quick introduction of myself. My name is Adolfo Segovia. I was born and raised in Mexico. When I was 18 years old, I was abducted by a drug cartel. And then a couple of weeks later, I was jumped at gunpoint by other people. Then I had to escape Mexico, so that created depression in my life. And I struggled with depression for about 10, 12 years until finally I was able to recover. And now I've been, for a couple of years now, I've been feeling pretty good and living the best of my life. So I created this podcast so we can help people who are dealing with depression fight it and get over that. So, doctor, thank you for joining me tonight. I'm super glad. Full disclosure, he is my doctor. I would 100% recommend him. He's one of the, in my opinion, one of the best doctors I've seen, for one primary reason, because he spends the time with you. So 100% recommended. And doctor, thank you for joining us. Please, can you introduce yourself?
Sure. Dr. Dimitri Gitelmaker. I'm board certified in internal medicine, also board certified in obesity medicine, helping people lose weight, preventive medicine. I studied at Rutgers Medical School and undergrad as well. Did my internal medicine training in Boston University, then did a fellowship in nutrition and preventive medicine at Columbia University, New York Presbyterian Hospital, New York. And did another fellowship at Harvard Medical School in obesity medicine. Currently living in Miami, Florida, living my best life.
Perfect. Doc, I'm going to ask you several questions that I would like to know as someone who struggles with depression, and that I still have a ton of questions about depression. I still barely understand it, and I think there's a lot of misconceptions, a lot of questions. I mean, there's still a lot of people who don't believe in depression, who think it's a joke. And that is my first question. Is depression real? Or is depression just something for weak people, for people who don't, I don't know.
So let me first start off thanking you for allowing me to speak to you.
Thanks to you, Doc, for coming.
So this is an interesting concept. There are measurable means of verifying that people have depression, which is a little bit different from sadness, right? Like people can be sad, they can be happy. Depression is a clinical diagnosis, and there are questions that we ask and certain tests that we run, and we can quantify depression as well. So you can be a little depressed, or you can have major depression with psychiatric symptoms. So there's a whole field of medicine called psychiatry revolved around treating depression. Sometimes when you mention that depressed people are weak, it's a little bit funny. I'm an evolutionary biologist by training. And so what I looked at is what are the reasonings, what are the reasons that we have certain diseases and certain traits. So like some people are more anxious than others and have an anxiety disorder. Some people have some sadness and some people have major depression. Why is that? I don't know if you've ever seen that movie Inside Out, and where you kind of get an inside look into a child's brain and how different emotions control her. One of my close relatives, she's a child psychologist at Yale, and she talks about how that's the worst movie ever because it teaches children that their emotions control them. and it's the opposite. You should be in control of your emotions, right? But anyway, in that movie, the sadness, which everybody hated, said all the other emotions hated sadness because it brought everyone down, was super important because it lets you ruminate and think about different things in your life that could be better and fix them. It gives you a call to action. Some of us go through severe trauma in our lives, and have something called PTSD, which used to be called shell shock back in the 19 teens after World War I, and then slowly progressed into what we know now as PTSD, which a lot of veterans suffer from.
Which is depression. PTSD is a form of depression.
So it's an interesting question. It's a little bit different, right? So you can have depression and you can have on top of that PTSD. So post-traumatic stress disorder is more of like an anxious state where,
Well, full disclosure, the first time I saw a psychiatrist, I was diagnosed with major depression disorder, anxiety, ADHD, and PTSD.
yeah.
So I guess I have a little bit of
You have a
everything.
little bit of everything. Well, maybe, aside from, let's say, schizophrenia, right? There are other things you could suffer from as well in a
Yeah,
psychiatric
there's a
field.
ton of mental health
Right,
conditions.
right. So, you kind of have this collection of mental issues that are kind of all stem from your childhood trauma. That's what it sounds like. On top of that, you might have some genetic factors. Depression might run in your family. That's why whenever you go to a psychiatrist, they always get a background. Does it run in your family? Do you have other substance abuse issues, right, in your family that could trigger depression? Do you have military service, right? So people that have military service often suffer from depression and PTSD and anxiety. For anxiety, for example, I often talk to patients about why are they anxious? And this concept goes back again to evolution, and our ancestors, when they were running, through the savannah or in the jungles or in the tundra or somewhere, right, in the world, they didn't have walls around them. They didn't have a roof, and they might come upon a bush that might rustle. And our ancestors ran because it might have been a tiger or something else that would jump out and eat us. And so they survived. 99 times out of 100, probably it was just the wind. But that one time, might have been a tiger and jumped out and ate that person. That person didn't survive. That's why there's so much anxiety in the world, right? And because over the course of millennia, millions of years, let's say, the people that were frightful, that had anxiety, that thought this is probably going to kill me, this wind, but it might be a tiger, ran, they survived, and had children. Now, we live in a different time. Like we're sitting in this room, there's 4 walls, there's a roof, air conditioning. Nobody's threatening us at this point. So right now, we're pretty safe. But you might start thinking about the problems you had 20 years ago, or the problems you might have in 20 years.
It's very interesting what you just said, because I'm reading this book called
Sapiens.
Sapiens.
I saw it on your bookshelf.
Sapiens.
So that's a great book.
And it talks about that, that why, I mean, it doesn't talk about depression, but it talks that how society have changed, correct? So obviously, 1,000 years ago, we were, as you just said, now we are trapped in 4 walls. We have to, we spend a lot of time sitting down, when before people were active all day. You have to hunt to eat. So there was really no time to be wondering things, to worry about the past, because you had to live in the present all the time.
You didn't get enough likes
to
on
survive
TikTok.
right away.
You didn't get enough likes on Facebook or Instagram.
Exactly. How many likes on Facebook? How many likes on Instagram?
First world problems, right?
And computers and cell phone. And in the past, 1,000 years ago or more, You had to live, I mean, even 1,000 years ago.
Or now.
500 years, I mean,
Or now.
100 years ago, there was no electricity. Well, a little bit more, maybe 150 years ago, there was no electricity. So people had to go buy candles. You know, there was a completely different lifestyle. You had to go buy food every day. Now we have like everything easy. And by making things too easy, it's creating other problems to humans.
Right.
That's basically what the book says, or at least what I understood.
There's another, I don't know if it's from that book or from the follow-up, from Naval Harari. He talks about around the year 2000 was a turning point in human evolution, where more people were dying from suicide than they were from homicide, wars, everything combined. More people were dying from being too fat than they were from starvation.
We talked about this the other day in your practice.
Yeah.
There's more people dying from suicide today than from all the wars together.
Yeah.
Why? Why the increase in suicide? Why the increase in mental health problems?
Human progress, right? We're progressing to the point where we solve, have you ever heard of Maslow's hierarchy of needs? So our basic needs are all met. And what's the pinnacle? It's purpose, right? Like self-actualization. What's the meaning of life? Our ancestors didn't have time to think about that. They were more concerned about how am I going to get some food for my children. Okay, now we've solved that problem. Next is, my friends, I don't have enough friends. It causes depression. You need social, that's like a step down below self-actualization, social stature, right? You need to make sure that you have a nice group of friends. Some people get very depressed because they don't have that. I'll tell you, the people that didn't have food 100 years ago or 1,000 years ago, they were pretty depressed. They just, didn't have maybe enough time to worry about it too much because they had to go out and farm.
Yeah, but they were not depressed because they would take action and go hunt.
But they might have been,
Yeah,
if they missed the deer.
Middle ages when they were still when there was farming.
Yeah.
And then
when they were
all their
toiling.
crops died.
When they were toiling.
Yes.
So it's all about I think that Maslow's hierarchy of needs is a good explanation for that. Is that we have depression over things that are important to us.
Yes, and I actually agree with you, and we didn't talk about this before, but I agree with you. I think that society is moving too fast, or technology is moving too fast for us to adapt.
That's an Einsteinian principle, right? That our culture isn't keeping up with our technology, which is probably true. But all for the better. There's a positive book I want you to read called Abundance for the audience. It's a great book. And it talks about how the future is bright, that we won't lack for anything, including water, including food, including freedom, including everything that we need. Socialization as well, as we get plugged into the metaverse, right? You'll be able to go and interact with anybody at any time, almost in a physical form.
But don't you think that's going to create even more depression? For example, the metaverse. We're going to be sitting down using goggles, or that's the kind of the idea.
Yeah.
There's not going to be physical interaction. It's going to be just in your mind.
It'll create its own set of problems.
It will create a ton of problems.
For sure, yeah. But it'll solve a lot. It'll create a lot. It's all about balance and
because I believe that as humans, we are wired, and we have this maybe in our genetics too, that we need human interaction, we need contact, so if we move towards technology and talking all day online on that computer, that's going to create a ton of problems. I think.
I mean, we're kind of doing that now, right?
Yes, but it's going to become worse.
What is that condition called? Computer neck, or the iPhone neck? Everybody's slouching down and texting, and people having a lot of neck pain because of that. But now it's the kids and adults too texting. Before we can at least talk to people. Now we just write them short messages with a lot of typos.
Yes, and now
using our meat sticks.
with the metaverse and with the Apple lenses,
Yeah.
we're moving towards that, and I know that's the future. It's happening, but I believe it's gonna create a lot of problems. It's gonna get depression and suicide. I think it's going to increase.
So I just had a baby last year, and God bless her, she's already like using. At 1 year old, she's already using the remote on my TV to find YouTube videos and put on Miss Rachel. She loves Miss Rachel. And she does it. She's 1 year old. She's already like, so I talked to this is my same cousin, clinical professor of psychology, and asked her by text, by the way, is it better to restrict screen time or optimize their environment with screen time to improve their learning capacity? So, YouTube has the YouTube University kind of thing where, I want her to take singing classes so she doesn't have to leave the house, put on YouTube singing classes, and there you go. And she can learn a different language on YouTube or learn how to count on YouTube and all of these
Amazing
things that they might offer. And so anyways, I'm concerned, like, is she getting too much screen time versus, like, well, is she learning like the 1, 2, 3s and colors and shapes on that Miss Rachel is teaching her, right? And her answer was, it's, let me see, I'll tell you exactly what she texted me back.
I don't know what she said, but I think she probably said yes.
And
Right.
I hope she doesn't mind me quoting her. But the answer was, we do not have a choice but to optimize. This is like attempting liquor prohibition, right?
Yeah.
So you're not going to stop progress, is in other words what she means, right? So
Yes.
screens are everywhere. Kids are going to get exposed unless, you do homeschooling in the woods, right?
And maybe since they are getting so used to the technology at an early age, their brain is going to adapt. Because I feel like, for example, in my generation, I started using the cell phone when I was maybe 15, and there was one of those very old, basic phones. But now I'm 34, and during my teenage years, I experienced all the new cell phones, all the new laptops, all the new stuff. So I feel like my brain maybe wasn't that used to that technology because it moves so fast. Now
Yeah.
I use 3 screens.
Yeah.
And I grew up, I spent 15 years with nothing
No
pretty
screens.
much. No screens.
Just dreaming about a screen.
Just maybe the one TV, that's it.
Right.
And it was still VHS.
Yeah.
And by the time I'm 20 something,
8-track.
I have more phone, a laptop, then you have a phone, a laptop, and an iPad, and then now I have 3 or 4 different screens, and I'm looking at my phone almost all day. So my brain, I think it was not ready for that.
So, I mean, there's that overarching idea that are we just getting too much technology, too much screen time, too much being plugged in, versus a more granular concept, which is it what we're interacting with our screens? So I often tell people with depression, turn off the news.
Yeah.
Because it's programming. They literally call it programming.
Yeah.
Right? And so what they want you to do is be depressed and watch their show to make sure that you stay depressed by learning about all the different difficult things that are happening in the world, which happened, like I said, more murders happened in the 70s than they did now, for sure.
Yeah.
Were people depressed about it? No, because they just didn't watch the news as much. Now you have streaming things about the wars and the world and, things that are happening on the other side of the world. There's a tsunami in 2004 that hit Thailand. Everybody is sad about it around the world. Did it really affect people in New York? Not really. Unless you had family in Thailand, right?
Yeah. Okay, Doc. So we agree that depression is real. It's a real. It exists. So what is depression?
I mean, there's 294 million people with it, right? They're
Yes.
clinically diagnosed. So yeah, it's real.
What is depression, doc?
I think boiled down to biological or biochemical reasons, right? It's an imbalance in the brain of neurotransmitters, specifically serotonin, dopamine, a few others. That's why, the antidepressants, or what I like to call them, is mood stabilizers, because people say, when I tell people they have to go on antidepressants, they give me a look. When they say mood stabilizers, oh, that sounds lovely. Like, I want my mood to be stable. I don't want it to fluctuate and get like these depressive attacks, right? But, taking the word out of antidepressants, I think, solves some of that stigmata that is associated around depression. Maybe. We'll see. Um, and again, you can clinically diagnose it, as well as you can use MRI technology now to see parts of the brain that might be, underactive or overactive. And
What happens in the brain of a depressed person?
so basically the easiest way to explain it is a chemical imbalance. Right? It's very complicated. There's areas of the brain that control emotions that are like deep down and go back millions of years to when we were, because again, all of these emotions have a reason, right? There's a reason that you get emotional. They're usually self-defense, right? If you're, our ancestors that got depressed in the past, probably, again, was a motivator for them to do better and improve. And those are the ones that survived, that felt like, man, I messed up, I feel really bad about it, I'll do better. And then they're able to then do better and then become successful, theoretically, right? So it's a call to action from our brain. It says, like, do better. You messed up, or I'm in a bad situation. Let's get out of it. If you're always happy and you're in a dark spot, like physically in a dark spot in your life, you're content. There are some movement like the Power of Now is, I recommend that to all of my patients with anxiety and depression, where the author talks about how he sat on a park bench for 3 years and was at bliss. Didn't produce anything, but came out and then, started doing things. He realized that, yeah, he was at bliss sitting on a park bench for 3 years, but he didn't produce anything.
Look, it sounds like so like easy. Okay, depression is a chemical imbalance. So
I try to keep things simple.
you take your mood stabilizers and then magic. But the reality is that it's not that simple. Why, if it's just a chemical imbalance and we take medication many times, it doesn't work. It's just not just like, okay, I have a chemical imbalance, I substitute whatever type of serotonin it's missing, and
Yeah.
then I'm gonna be happy, and it's not like that.
Yeah, so I mean, there are treatments outside of taking drugs, right? There's been a whole revolution around psychological treatment of depression. That started with Freud and moved on through Jung, and there are, a whole list of famous psychologists that didn't use drugs in order to treat, psychiatric disorders. So the current one that's in vogue is CBT, right? Cognitive behavioral therapy. Now they have DBT, which is dialectical behavioral therapy. So what they study is input and output, and what's the process in between. What I mean by that is you have an outside influence, something happens, a trigger, right? They call it now. In vogue, triggers. Your brain processes all that, and there's a whole list of things, or a whole mechanism of things that happen from the input, which then the output would be, I feel depressed and I cry and I'm sweating and I feel anxious and I feel like my heart's jumping out of my chest. Whatever the emotional output, occurs. And so the idea is first to understand that. What is the process that my body or my mind is going through before there's a behavioral output, which is me getting angry and screaming at somebody because I feel angry or depressed or what have you. And the key is to see how that input goes in and how to block that initiation of all this thing. And if you can't block that, block it somewhere down the chain so that you can calm yourself and then not have that behavioral output. That's behavioral therapy, right? Cognitive behavioral. So essentially, understanding that is a good start, and that's without meds, but that takes intensive therapy that you get to underlying understanding of how your brain works and how to cut off those negative inputs
Yeah,
at the start.
but then you have all these people who have been struggling with depression for years, who have been to bunch of psychiatrists, psychologists,
Yeah,
and they end up committing suicide.
yeah.
Why we cannot, why we haven't been able to solve the problem? If I from what I'm hearing from you, it's pretty well studied. There's a lot of things right now, but that's like in theory, but in practice,
Yeah.
people are depressed.
Yeah.
They spend years in the psychiatrist. They just get worse until one day they kill themselves.
Right. Let me answer your question in a different way, which is, in my opinion, my professional opinion, that we're living in the dark ages of medicine. Like we think, well, we're pretty advanced technologically. Not really, right? So like in the hospital, for example, patients ask me, how long do I have to live, or some question that I can't answer. And I tell them, medicine is just not advanced enough, to tell me that, or if we can't solve a certain problem with the current technology, what's the first thing we do to a patient in the hospital? We poke them with a sharp object at 5 o'clock in the morning to get some of their blood. Pretty barbaric. Why
Just to see if he's alive.
don't we have that Star Trek tricorder thing to measure their potassium levels? No, we got to poke you with a needle in your arm at 5 o'clock in the morning. Hospital's supposed to be a place of rest, right? Recovery. No, we wake up in 5 o'clock in the morning, so the doctor by 7 o'clock can see where your potassium levels are, or your blood counts, or what have you. So what I mean by that is, yeah, we have progress in psychiatry and psychology, lots of new medicines, lots of new techniques. We're just not there yet to solve everyone's problem, right? Magically, but slowly but surely we'll get there, right?
But depression now, it's a major problem in the
Yeah,
world
for sure.
right now.
Yeah,
And suicide, it's a major
for
problem.
sure.
And we're still, I mean, I don't understand it.
Yeah,
I mean, it's a chemical, it's real, but it's a chemical imbalance.
Yeah.
And then why there are so many types of depression? Like some people, like right now, you have like, this teenage 16 years old who broke up with the boyfriend and she's depressed, and they call it depression, and in school they call it depression. And then you have, you know actually the question would be, how can you determine if it's just sadness or real depression? How can you know
Well, I mean,
when things are
you have to
getting
go to a
bad?
doctor and get diagnosed, right?
And the doctor will just ask you a couple of questions and say, oh yeah, it's
Yeah,
depression.
there's different testing that can be done. The simplest one is called PHQ-9, which is essentially 9 questions. And over the last 2 weeks, have you had this list of 9 symptoms, and how often? And you can quantify, so not qualitatively, quantify how bad someone's depression is. So out of a score of 27, they might score, let's say, a 20, which might point to severe depression, which will
But
require
I think
treatment.
that's very barbaric. It's I don't think it's accurate. How can you measure someone feelings just with numbers?
Well, they tell you, right? I mean, like over the last 2 weeks, have you felt down? Have you had trouble sleeping? Are you overeating? Do you lack interest and pleasure in doing things? Just like basic, things that you might have a little bit of sadness, but if you're having physical outputs of depression, which are, hypersomnia or insomnia, overeating or undereating, do you have lack of interest in doing things? There's like 9 things that are clinical signs of depression, and then you can quantify, which is nice because, well, you're depressed, but okay, how severe is your depression? When do you meet criteria for starting medication? Or we can do some talk therapy, CBT. Are you at risk of killing yourself, right? Then may have to hospitalize you. That's a whole different conversation at that point.
On our last
Yeah.
podcast, on last episode, we had this girl who she started experiencing depression at the age of 12, and by age 13, she was hearing voices telling her to commit suicide, and she was in a psychiatric ward.
Yeah.
What? And then when she was there, the doctor said, "Oh, she's mildly depressed. She just needs some medication, and that's it." Like they treated it as something simple. However, she was cutting herself, trying to kill herself, and she spent middle school and high school and a part of college depressed and sad and in a terrible life.
I think they call that a poor bedside manner, right? I don't know the specifics of her case. How was she diagnosed? It sounds like she had schizophrenia or some kind of
But she didn't have
delusional.
schizophrenia because she was not diagnosed with schizophrenia. But she said she was hearing voices. But then why when she was 12? What happened in a 12-year-old child to try to kill themselves?
Yeah. So
And now we are having kids
yeah,
committing suicide too.
yeah,
14, 12. I think I heard of a 9-year-old kid.
yeah.
Why?
It starts early in life. I mean, it's specifically with genetics,
But
right? I
it's
mean,
like any other condition. Like today, you can be good today, and tomorrow you get a chemical imbalance in your brain, and suddenly you are depressed and you want to kill yourself.
I think it's I think a little complicated. Probably having a multivariate approach to that question is probably the right thing to think about. Some people might start being depressed in their very early years. Why? Maybe because of genetics, or they had a traumatic life event, a big move, for example, to a different continent, right? Might cause a lot of trauma in a child,
Yeah,
or a divorce,
she mentioned that her parents didn't have a good relationship,
yeah.
but still,
So
it's
maybe.
it's hard to understand how by seeing your parents fight or not have a good relationship or argue, you get depressed to the point to want to kill yourself and end up in a psychiatric ward.
Yeah, I mean, some teenagers experience a lot of bullying and trauma, and may have a quote unquote broken home. And you can't really judge other person's life experience and say, well, they just had minor trauma.
But that's what the
Why are
doctor
they so
said.
severe? But it's a poor bedside manner, right? And I don't know, what the exact situation was, but approaching it with a little bit more empathy is what it sounds like was required at that moment. Um, I did a lot of traveling in my life, visited about 34 countries. And one of the most interesting places I've been to is Thailand, specifically the Udon region, where it's mostly rice farms and other kind of farms, tree farms. And the people that were working on those farms, they lived on $30 a month, $1 a day, subsistence. And they lived in houses without walls. So it was just basically a thatched roof with stilts, keep the bugs off of their beds, which was just a wooden floor. They'd get a bag of rice would last them a week. They'd pool their money together to get that bag of rice. Sell their kids off into all sorts of horrible situations that I can't even discuss, right? But I came back to the United States, and I was talking to a nurse, and she was saying that she had depression. And in my mind, I was like, what do you have to worry about? Look at these people. It's a comparative analysis, right? Like you have refrigerator.
Yeah, so
You
in
have,
essence, we have
and
everything.
then she got mad at me. She got mad at me for
Yeah.
saying that to her. She's like, "You can't judge me on my experience. So this is my experience, and in my situation, again, Maslow's triangle hierarchy, right? She had her basic needs met, but she's worried about social interactions in her family. that her son wasn't at his best, that her husband is cheating, or what have you, right? So you can't judge a person's life experience and how it makes them feel. You kind of just have to be more, maybe a little bit more understanding. It sounds like that's what those doctors needed. And specifically, I think in like a psychiatric ward, the doctors' lives are difficult there. The patients have serious issues that they have to deal with. And so I don't know. I think there's maybe just a lack. I think the word is empathy, right? Taking away the stigmata of people having depression, because I think it's underdiagnosed. I think a lot of people are not self-reporting to their physician that they feel depressed. Like I sometimes have to pry it out of people, right? That people come to me for, my belly hurts. There's something called psychosomatic symptoms, right? Like their belly hurts because they're depressed or anxious or what have you, and they're having an IBS-like symptom, which is your body reacting to how you feel.
But then you are basically telling me that depression is under prescribed, right?
Underdiagnosed. Yeah,
Underdiagnosed.
for
So
sure.
there's even more depression that we
Yeah, but
think.
at least you're in good company.
So there's what is causing all. I mean, well, we already talked about the causes. So yeah, to be honest, I kind of agree with you. I kind of agree with you because when I was depressed, and you just heard a little bit of my story that I suffered traumatic experiences, right? But when I was depressed, I remember that made me feel even more depressed because I was like, okay, I live in Miami, I have a job, have everything. I live in an apartment, a beautiful apartment in front of the beach. I'm sad,
Yeah.
and
What was missing?
what was missing, and
A
I have
cat, a baby cat.
a baby cat, or in my case, what actually helped me get out of depression was working out.
Yeah, for sure.
And I mean, I'm sure a lot of people watching are gonna probably get mad because how come it's so easy to not cure, because I still have some. I still get depressed. I call it an everyday
Yeah,
fight.
yeah.
Some days I have my bad days, where I feel sad, where I don't really want to get out of bed. I have the ADHD is actually pretty bad on me. Like if I don't take the pill, it's very hard for me to function. But the depression, I since I started working out and moving and getting out of my house and getting out of this sadness in between four walls, that's when things started to change for me. And going back to my last guest, she said, I asked her when did these things started to change, and she just said, things started to change when I got sick and tired of being sick and tired, and that's when things changed.
Yeah.
So it is like a chemical imbalance, but if you decide I want to stop being depressed, you can do it.
It's a good start.
Yeah, it's a start.
It's a good start.
So, is there any type of depression that is not gonna change with any type of exercise? Even like, what is the top level of depression that exists out there?
It's a spectrum. I think more than a pyramid. And every person is different in how their body reacts to their chemical imbalance and their genetics and especially their environment, right? So, I so often talk to patients that are cool as cucumbers. I'm just like, no, I'm good, and everything is fine. I'm jealous because I have my own bouts of depression, right? And I'm like, how are you never sad? Like, I don't get it.
But sadness is not depression.
No, but even they're not even sad. They're like, no, I'm always kind of chipper. And you meet these people, and you're like,
No,
what's
I
going on?
know.
Yeah,
My dad is one of
yeah,
those. My
yeah,
father, he have suffered a lot.
right.
I think that if he tells you some of his stories, He have experienced horrible things in his life,
Yeah.
horrible things from childhood, marriage. He have seen people die, like family. His son was kidnapped by a drug cartel, and they were telling him that they were gonna cut my penis. So you can imagine how you feel as a dad when they tell you they're gonna kill your kid if you don't pay them. And now I talked to him and I said, Dad, do you want to go to the therapy? Do you want to? No, I'm happy. I'm
Yeah.
fine. I don't need anything. And I have sent him money to go to the psychiatrist. And he goes and he tells me, he said, I'm fine. He said, I'm perfect. So I'm like, I don't understand it.
Why do you send your dad to the psychiatrist if he says it's okay?
Because I think he has some issues. He's not sad, but he have other issues.
Everyone has issues, but they might not necessarily. I like that. I like the line from that movie Crocodile Dundee, where the New Yorker is telling the guy from the Outback, like what explain to him what a psychiatrist is. It's like somebody to go to talk about your problems, and the answer was he doesn't have any mates. Just talk to your friends, right? Like let it all out. Um, I think so. It's always a good idea to get things off your chest. Whether or not your dad needs psychotherapy, it all depends on how he's dealing with
No,
the things that happen. So he probably
he's
doesn't need it.
actually pretty happy
Yeah,
every day, and he's the type of person that even if he's having a terrible day, he's not gonna stay home. He's not gonna stay between four walls.
maybe that's why he's happy.
Yeah,
Maybe because he's
yeah. No,
active.
I agree. I
How
agree.
old is your dad?
She's like 66,
So
67.
still pretty young. There's a thing with getting older and getting more and more depressed because you lack the ability to walk as well, to exercise as well, to perform as well. So it's a very serious thing, like depression in the elderly. I think it's very underdiagnosed, and a lot of physicians are starting to recognize it more, specifically in the geriatrics world, where you know it can mask itself and present itself in lots of different ways, like memory loss. So we're now in my office, we're starting to do these cognitive screening tests, which are extremely extensive. And we test for heavy metals and all of these. Like if someone has like memory loss, one of the things is making sure they're not depressed, right? Super important.
Making sure we're not depressed.
If for mild cognitive
But
decline
if
or
someone
for
is depressed, what
yeah.
would you ask them to do?
Well, you kind of, well, first of all, you ask them, right, do you feel depressed, right? Like, and if they're starting to have memory loss, because that can present itself, you know.
Yeah, when I was, there are two very important things, psychosomatic um, symptoms. So, as I just said, and I think I have to tell you this so that you can explain me more. As I said, I was taken by a drug cartel. Then I was jumped at gunpoint like 2 months later. Like another month later, the cartel started asking my family for money, so we had to escape and come to Miami to start and to running away from the cartel.
Yeah.
And when we got here, we started from zero, like nothing, living in a studio. My mom, my dad, my sister, myself, alone, no one. And and then we opened a business. We were successful. Then we lost everything, and that's when I started having problems. But my problems were not. I never thought I had depression. I spent almost 5 or 6 years with all type of conditions. I couldn't sleep. I was peeing all night. I just wanted to cry. I was tired, like extremely tired. Uh, I I didn't even want to talk. I was not. I couldn't smile. But I had physical symptoms like I couldn't eat. So I went to see all these type of doctors, and no one had an answer to me because they would do like, okay, I have I cannot eat anything, and they would look at me and, oh, you don't have anything, you're good. Oh, I'm peeing 6 times at night every night. Maybe I have diabetes. Oh no, you don't have diabetes. Oh, I'm falling asleep at 2 p.m. I'm 24 years old. Maybe I have low testosterone or low vitamins. Oh, your testosterone is, well, my testosterone was bad, really bad. But other than that, but in the normal range. So, anyways, I had all these type of physical symptoms, but at the end of the day, it was all the depression. So, yeah, the brain that controls everything, it creates other type of problems.
I agree with everything you said, except that part where you said the brain controls everything.
No?
You're more than your thoughts and your brain.
Okay, but so the brain doesn't control
It
everything?
doesn't control everything. It doesn't control, your presence and your soul, right?
Okay.
So Eckhart Tolle wrote that Descartes very beautifully said, "I think, therefore I am." It's wrong.
Yeah.
It's wrong. It's wrong. You're more than your thoughts. He writes that your brain is a tool which is used to solve problems. The issue is when you don't have a problem, like you're right now, there's no problems that you
Yeah.
currently right now have.
It's true.
But you might have thoughts that, I messed up, or this happened to me, and it makes you sad, right?
We have too much, and yeah, we don't.
People aren't living in the moment, and so your brain can be your worst nightmare. When you're laying in bed at night and having recurrent thoughts and not able to let those go.
Okay, Doc. So to get a little bit more specific, what can you tell someone who is struggling with depression right now that he wants to kill? He's sad in bed. He wants to kill himself. What would you tell him as a doctor?
So the first thing is call the suicide hotline. It's anonymous. Just talk to someone.
Okay.
If it's a crisis situation. Perhaps even drive yourself to the local ER or call the emergency. Just if you're at the verge of suicide, the first thing I would do is contact some kind of healthcare professional emergently and get evaluated to make sure that you don't end up dead. This world is too beautiful to let go. There's so many amazing things. You just have to kind of open your eyes a little bit and see them, and not let your brain push you off the ledge, literally.
Yeah.
Second thing is, if you had been, through the whole psychiatric world, and without any improvement whatsoever, whether it's psychologically, being treated with cognitive behavioral therapy, dialectical behavioral therapy, and if you're on drugs, theoretically, there's actually a new technique now called TCM, transcranial magnetic treatments.
I did it.
You had that done?
Yeah.
So tell me about it.
It helps,
Yeah.
but I mean, I don't want to make it look so simple because I know people can get offended. But in my opinion, the best way to deal with depression is move. Just move.
No, I agree.
Just get out of your house. Just work out. Leave. Stop thinking. Stop spending hours in your bed, complaining and whining, and stand up and go run 10 miles. And I think the depression will go away.
Well, what did we start out talking about?
I know.
Is hunters, right?
And
when you're too busy running for the
I get
antelope.
you 100%. But a lot of people watching are gonna be like, no, these two guys are crazy. I mean, it's not that simple.
Well, we are crazy.
I've been suffering for 20 years.
Yeah.
I'm sad. I'm crying. I want to kill myself. I mean, because I experienced it and it's horrible. And I wish someone would have told me just go to the gym and it's going to change your life. But I don't know if it's that simple. But maybe it is that simple.
Or as simple as making your bed. Did you listen to that? He wrote a whole book about it, about, even if you had a terrible day, you come home, at least you have made your bed, you accomplished something.
Yeah, yeah. I don't
And
think.
accomplishments build, right? You get a small
Yes.
accomplishment and
Yeah, little
you
things.
feel accomplished,
The little things.
and all of a sudden, like, I'm worthwhile, right? I'm contributing to the world. Go volunteer, go, work in a soup kitchen, help other people. That helps me, right? So I go to the gym, and I'm a physician who helps people. So I'm in a unique position to do that for a profession, but anybody can help another person. You see somebody in need.
Yeah, but the volunteering helps a lot.
Yeah,
I actually volunteered for a couple of years at a Miami Children's Hospital. I
yeah,
was just playing with kids,
yeah.
but I was still depressed. I
But
was still sad.
but at
It
least
helps, yeah, but it
yeah,
does
it
help.
does help. Yeah. So I mean, you do various things, right, that are outside of medicine, right? Like, I know some people are very anti-pill, which I totally get. Um, so find other ways to help yourself, right? Like, volunteer, work out, go for a nice long run, eat healthy. Some people get depressed because their diet is crap, right? And they just eat all these processed foods that have a lot of these chemicals and so clean up your act.
And
You know,
what
take
about trauma? People who lost a child, someone who
It's
lost some
tragedy.
tragedy. How can you deal with
How
that?
do you deal with it, right? I mean,
I mean,
uh,
yeah, at the end of the day, you have to, once you get in peace with that you lost
yeah,
someone that you love, which is super hard.
you're never at peace with that.
But
That's the thing, right?
when you
But
at least can have some type of understanding
yeah,
that you have to move on with
yeah,
your life.
right.
So, I mean, it sounds simple, right?
You'll never get over this trauma that happened to you, right?
Oh yeah, no, it's
Like,
there. I
uh,
just don't feel pain anymore.
like when you talk to like Holocaust survivors, so the entire family wiped out in front of their eyes, lived in a concentration camp where they were slaves. They move on. Somehow they recover, but it's hugely traumatic,
But
right?
there's still some pain in your
Of
inside.
course, it never goes away, but maybe the right word is peace. Maybe there's some other good word for it. Maybe it eludes me at the moment, but yeah, you move on. I think that's, and you find your purpose in life. You contribute and you help humanity make things better. You do good things in life. You can choose a path, right? You can become evil. Some people do that. Bad things happen to them and they think the whole world is evil, and they become evil because that's what they know and that's how they deal with things. Or you can become good and you can help and contribute and feel good about yourself that you know, you haven't become demonic in a sense because of your horrible life situation. And so
Um,
you went the angel route. You went the angel route, and because you have this aura about you, right? And um,
Obviously, doc, schizophrenia, all those are different things, right?
well, it's much more severe, right? And so
But it's similar to depression, but more severe, or it's something totally different.
it's different, and it's, the schizophrenia is in some ways a lot more tragic because first of all, our understanding of it is very limited. I actually did a project in college studying the genetics of schizophrenia. So I know a little bit about it, but and there's different forms of schizophrenia, but very difficult to deal with, and you kind of become debilitated almost immediately. It feels like, sometimes depression, you can kind of snap out of it, to use a very crude term. Schizophrenia it's much more severe, in my opinion. But the psychiatrist probably can answer that question better than I can. Um, because working out is not going to help schizophrenia.
Yeah, no.
You know what I mean? Like, working out will release
But it's
endorphins and make
still
you feel
chemical
good.
imbalance, or it has something
No, no,
else.
it's much more complicated. Much more complicated. We don't, at least I don't have a full understanding of why it happens. And even the treatment, I mean, lithium, and some other antipsychotic medications. but it's like, the voice is quieted down, but they never really go away. Some people have mild forms of schizophrenia. They have like visual hallucinations. They kind of see weird things, but it doesn't really bother them because they just get used to it. Like, that's my schizophrenia. Sometimes you'll hear things. Yeah, I hear things, but they don't really bother me. But if, a voice in your head is constantly berating you and telling you to do weird things and constantly, that's very, very tragic kind of situation. And it can lead to, a debilitated situation for some people.
Suicide, doc. How can we help people don't commit suicide? What's the problem there?
I think
It's just that
at
depression
the
advanced, or it's really something in your brain that changed that you just want to kill yourself?
like hopelessness, right? I think you have to deal with the hopelessness of the situation, that there are ways of recovering from these intrusive thoughts.
But it's still a chemical imbalance.
I think at the baseline, it's relieving the stigmata around it. Some people go around having these thoughts and don't tell anybody because they're like, oh, I'm going to be judged that I'm
Yeah, no, that's why
started out
I
saying.
said this about weakness, not because it's weakness, but there's still this stigma that being depressed is for weak people.
No,
especially maybe not in America, but at least in Mexico.
If you had a heart condition,
Yeah,
if you had a
you
heart
got
condition, you say
treated.
like, I'm weak, I have a heart condition.
Yeah, but since this is the
Like, no, you have a
brain,
heart condition, you have a brain condition.
doc, I have family members who are depressed,
Yeah,
and they don't want to go to the doctor
course.
because they feel it's for crazy people.
yeah, right. It's the stigmata around it. So the first thing we need to do is,
And this is one of the purpose of this, just
that
trying to
first
break
of
that
all,
stigma.
you're not alone, right? Like 300 million people probably underdiagnosed, like I said. You're in good company. What is that? That's like 5% of the world has major depression. It's a lot of people. It's the same thing with like substance abuse. That's another big area of psychiatry that has a lot of stigmata around it, where people don't want to admit that they have a substance abuse issue, don't want to get treated, and end up dead because of it, right? Especially now with opioids and alcohol has been
And
around.
food,
Food addiction,
too.
food addiction.
I also have a lot of family members who died from diabetes,
Yeah,
which is kind of like crazy because the doctor is telling them, hey, if you don't stop eating sugar or Coca-Cola, you're gonna die, and they keep drinking Coke until they die,
that's an addiction. It's
or Coke, or just bad junk food, tamales, tacos, pork. In Mexico they love pork, they love tamales, they love greasy stuff,
Sure, yeah.
and your heart is not working well,
Yeah.
and the doctor tells you if you don't stop eating, you're gonna die, and they keep eating until they die.
Right.
I have an uncle. He had heart problems, high cholesterol, and there, things where the blood is not flowing correct. I don't know how you call it. Well, he had heart problems because he was eating a lot of fat, cholesterol, triglycerides, all these things. He already had a pacemaker in his heart.
Yeah.
And one day for the Dia de Muertos, I don't know, Halloween,
Yeah.
he had like
Dia de los Muertos.
he ate 8 tamales
Yeah.
of pork,
Yeah.
and he had a heart attack that died.
Yeah.
That's it.
Yeah. Sorry to hear that.
Like, but it's like this. I think it's the most stupid way to die.
No, but that's the thing, right? That's the thing. You're calling it, it's really a dumb way to die, but that creates stigmata around that situation. The person had a disease, right? He was addicted to tamales, right? So we actually understand this quite well. About 10% of humans have this weird dopaminergic response. Dopamine is our like reward hormone in our brain. And when we eat or have sex or do drugs or drink or something like that, we have a reward, right? It gives us a little reward, dopamine surge. Most people can handle that going away. 10% of people can't handle the down. They just want the up. And so their drink wants a drink. their food wants more food. Once some people can fast and don't feel hungry. As soon as they start eating, they engorge themselves because their dopaminergic thing, goes up. Same thing with cigarettes. Like I can go a week without cigarettes as soon as I have that one puff, pack, right?
Yeah, I know about that.
Yeah, right. Yeah, and so it's an addiction, and it's a dumb way to die, right? No, it's just the person had a disease. They had an addictive personality to food or to drugs or to alcohol, maybe with an underlying depressive driver, right? You can have multiple things happen at once, and committed suicide by tamale.
Kinda. He
Right.
kind of killed himself
Yeah.
in
Right.
some way.
Right. So I mean, you have to like, because you said depression runs in your family too, right?
Um,
There's more
Not in my
diabetes,
parents, but
but
like in
yeah,
other family
yeah, it's
members.
very common, right? Yeah. So plus he had an addictive personality, whether it was to food or I deal with addiction to food a lot as an obesity expert. Um, and it's very difficult to break. And
Yeah.
and
No, I have a ton of family members died
and
from
right. So,
bad eating
and,
habits.
and and in America now, actually the world, you have about 70% of the population which is overweight. A lot of it has to do with how the government has dealt with the food pyramid or what have you, or the types of things that go into our food. People, whole foods have not been pushed very strongly. A lot of everything has high fructose corn syrup, which is super addictive and terrible for you. Like our body doesn't really know what to do with fructose. It's a weird thing. So it just stores everything as fat. So yeah, nobody's starving in America.
Yeah. Nobody's starving
Nobody's
in
starving in
America.
America. Well,
Doctor,
I don't want to say nobody, but almost nobody, let's say.
Doc, any type of
Which
new,
which way, which makes you sad?
what makes me sad?
No, I mean what that's it can make you sad that
Oh, yeah.
I overate and I feel bad about it. I
Yeah.
feel depressed.
Yeah, 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 yeah.
So
100%.
first thing you got to do is clean up your diet, clean up your exercise, fix your
Yeah.
lifestyle.
Start making
Get
little changes.
get yourself out of a situation that is bad for you, right? I mean, um, there's a lot. You don't want to run away, but you want to kind of fix a problem that's, if someone's poking with something sharp, get away from that person. That kind of idea. Get rid of toxic people in your life. There's like very simple things that you can do that
Yeah.
just it's actionable.
Yeah, I agree with you. I agree.
If
Again,
you, it's worse with family, but with friends, I mean, friends are easy to get rid of typically. But family is very difficult. If you have a toxic family member who's making you terribly ill with depression because of their actions, cut off relations until
yeah,
you're better and you know how to deal with that situation in a more healthy way,
yeah.
and not end up with being depressed.
Doctor, any type of new technologies or new advancements in mental health that you could share?
What's nice is that with the push for genetics and genotyping is a new test that came out not too long ago, which is actually covered by insurance. I just found that out. Medicare will pay once in a lifetime for PGX, pharmacogenetics, and it'll tell you exactly which medication is going to be good for you. And that's actually part of our cognitive program. Is if you have even a mild impairment of memory or some kind of impairment like that and depression, they'll pay.
I should do
The
that.
government will pay for you to have full like genetic genotyping. It's like a stack like this of all the different medications and how I forget the exact chemistry of it, but how your body reacts to that medication. It'll tell you exactly which medication. That's what again, abundance, right? You will have so much fantastic technology that our lifespans are going to get better. We'll have everything we need. We'll have more freedom. We'll have more peace, and things will get better.
Yeah,
I'm very optimistic about the future. Right now it's kind of a difficult time
me
in the
too.
world.
I believe
Yeah,
the future is bright.
yeah, definitely. Again, if you look at
There's gonna be challenges.
if
I
you look
mean,
at 100 years ago with World War II, right, where what is it, over 100 million people died within 4 or 5 years, and now you have these conflicts all around the world. But Yeah, thousands of people are dying, but not hundreds of millions.
Yeah, no, I think the future is bright.
Yeah.
I do believe there's gonna be a lot of people that are gonna get behind if they don't adapt. If we don't adapt, we're gonna suffer. But if you adapt, the future is gonna be beautiful. I mean, we have a beautiful present.
Yeah.
So, Doc, just to wrap it up, 5 things that you can recommend someone dealing with depression.
First of all, don't let other humans affect you the best you can. Specifically, with stigmata that's around depression, that has to be taken care of. If you feel suicidal or have severe depression, call a hotline for depression, or go to see your doctor, or go to the hospital. Don't let the thoughts of suicide take action. It's just not worth it, and you have a lot to contribute. It's a call to action to, number one, get help, and you'll be able to help other people. Humans are the most precious thing on this world, and we need more of them. I'm a humanist, right? Like I believe that somebody is going to be able to solve some problem for somebody. And if enough of us are solving enough problems for other people, we're going to have a great world out there. If you have tried CBT, have tried medications, and have tried fixing your lifestyle, maybe it's time for more novel approaches like TCM. Or I remember a story. I had an experience at Columbia because I was on the ethics board, and there was a patient who she was in her 80s and she refused to eat because maybe she was depressed, or maybe she just had enough of this life. And so the ethics committee got involved because can you force feed someone who's depressed in their 80s to keep them alive against their will? It's an ethical question. There's no answer for ethical questions. It's just what do we think
But
is
if
the best
she's
route?
depressed, she's sick.
But she's in her 80s. She's depressed because she's been sick, right? Or she's sick because she's depressed. But do we have a right as physicians to intervene on her behalf and put a tube in her nose and feed her, or on some other way of feeding her?
And there was like, okay, so
And how long can you do that?
so no one was able to talk to her and tell her, eat.
She was very clear. I don't want to eat. I want to die. Leave me alone.
So she was clear.
She was very clear.
Die. She had that.
She was very clear about that. And one of the members of the ethics board said the treatment here is electroshock therapy.
Did it help?
I don't know. I mean, I stopped being a part of that case. But that was the recommendation. It was like, okay, well, let's numb her up, so she doesn't have any pain, and shock her. As physicians, we'll save her life.
To make her eat.
To make her eat, to make her live.
Yeah, to give the shocks to her brain, to stimulate that part of the brain.
Yeah.
I mean, well, I hope it helped.
Yeah.
Okay, Doc. 3 books that you mentioned a couple of books. Can you repeat them so people can have them fresh?
Top read for anyone with depression or anxiety is The Power of Now by Eckhart Tolle. Amazing read. He even talks about it in the book. I wish I had taught this to my children a long time ago, or that every child should learn this, how to deal with these kind of situations. Abundance, if you needed a pick me up and feel better about the world, that's a fantastic read. It's a little long, but it's wonderful. The Bible.
Yeah.
Find Jesus, or I'm Jewish. So, find Moses, or find some spirituality. Think about your soul and how you're more than your mind. That you have this essence, this presence that is super important to the world. Very important. Every human is very, very important. We can't lose anybody. So, it's the same recommendation I would give to someone, again, with heart disease, or any other kind of disorders is get help. Don't try to do it yourself. I mean, you can, right? You can exercise and feel better and all these things, but
Yeah, fine.
talk
to a doctor.
talk to a friend. Talk to a friend and do something. You know, and maybe it'll get better.
Okay. Any last thoughts, Doc?
No, thank you for having me.
Okay, perfect.
Yeah.
Well, thank you everyone for joining us on this episode. I think this might sound simplistic, but as someone who struggled with depression, major depression, diagnosed ADHD, anxiety, PTSD, clinically diagnosed, I actually I actually agree with him 99 on almost everything. At the end of the day, it's something that we need to fight, and it can be, I don't know if it can be cured. I don't think it cannot be cured, correct?
Not yet.
Not yet. There's no cure, but if you fight it, if you get out and try to enjoy life, things change. I know it sounds simple, but it's actually the truth. We are just humans, and we were not made to we were not made to be in four walls all day, and that's why we are living. So that's affecting us. So get out, enjoy life, work out, be happy, love each other, love people, find a purpose in your life, and I'm almost 99% sure it's gonna help you a lot. Maybe more than any type of pill or medication. Okay, thank you so much for joining us. Have a great day. Bye bye.